Hey guys, this is Dr. Hub. Today we'll be comparing the ankylosing spondylitis as well as the diffuse idiopathic skeletal hyperostosis. So to begin with, the ankylosing spondylitis. So what is the etiology? The etiology is that it is autoimmune. And which is the age group? The age group is, it is seen in terms of the younger individuals. And what is the HLA? HLA associated is the B27. HLA associated is going to be the B27. So how is the lab investigations? Lab investigations, there is a significant high rise in the ESR as well as the CRP. Now let's move on to the syndesmophytes. So how is the syndesmophytes? So under the syndesmophytes, it is going to be marginal. It is marginal. And then looking at the radiograph, how is the radiograph? The radiograph, it is going to be bamboo spine. It will be bamboo spine. Next arises a question on the disc space. So how is the DS, that is a disc space? It is going to be in AS, that is the ankylosing spondylitis. It will be cervical spine. In terms of the cervical spine, it will show the ossification of the disc space. So there is nothing but the ossification of the disc space. Now we look at the SI joint. So what is the SI joint which is involved? The SI joint involved is the bilateral sacroiliitis. It is going to be the bilateral sacroiliitis. Then the question arises on the associated disease. So what will be the associated disease? The associated disease, it is going to be the autoimmune conditions. So it is an autoimmune conditions such as the iritis. Next, there is also the presence of the uveitis. Then there is the ulcerative colitis. Also the iritis, uveitis and the ulcerative colitis. Now let's move on to the DISH. So we already discussed the full form, that is DISH. It stands for the diffuse idiopathic skeletal. So let's write it down. Diffuse idiopathic skeletal hyperostosis. So what is the etiology here? Is this going to be idiopathic? And next is in terms of age group. In terms of age group, it is going to be in terms of, it is in the older patients. So it is going to be older patients, and or you can call it the middle-aged patients. What about the HLA associations with the DISH? HLA association is, there is no evidence associated with B27. So there is not significant evidence with the HLA B27. Next comes the question on the lab investigations. So how is the lab investigation? It is non-specific and inconclusive. So you can tell it is non-specific and it is inconclusive. Then we move on to the syndesmophytes. So what is the syndesmophytes? So in terms of the syndesmophytes, it's non-marginal. It is non-marginal. And then we look at the radiograph. So how is the radiograph in this case? The radiograph, it shows a flowing candle wax. It shows a flowing candle wax. So this is in terms of the DISH. Whereas in case of the AS, that is the ankylosing spondylitis, it was the bamboo spine. Now we look at the DS. DS stands for the disc space. The DS, that is a disc space, there is a preservation of the disc space. There is preservation, and this is nothing but of the disc space. And then we look at the SI joint involvement. The SI joint involvement is that there is no involvement, there is no involvement, and the SI joint abnormality generally excludes the diagnosis of. So the SI joint involvement. So SI joint involvement or the abnormality. So what they are telling is it excludes the diagnosis of dish. It excludes the diagnosis of the dish. Next we look at the associated disease. So in case of the associated disease, it is in terms of ankylosing spondylitis, it was the iritis, uveitis, ulcerative colitis. That is some autoimmune conditions, whereas in this case it is going to be the obesity. It is going to be obesity. It is going to be the DM standing for the diabetes mellitus as well as the hypervitaminosis. To learn and grow daily like this, please do subscribe.